Hi, I'm Dr. Kavipriya Soma. I'm a GP with special interest in women's health. Today we'll talk about endometriosis. So we'll talk about the pathophysiology of endometriosis, the investigations that's required to confirm the diagnosis of endometriosis, as well as the management. So let's simplify this for you all. So the first thing would be, what is endometriosis? So endometriosis is a chronic, painful, inflammatory condition. So in a normal menstrual cycle, the lining of the uterus responds to the female hormones in preparation for a pregnancy. If there is no pregnancy, the lining is shed at the end of that menstrual cycle. Now, in a condition where endometriosis is diagnosed, unfortunately, this lining is not just confined within the uterine cavity. It can be outside of the uterine cavity, which causes the symptoms that the woman experiences. Unfortunately, this condition is relatively common. It affects 1 in 10 girls, women, or whoever is assigned a female sex at birth. So what are the signs and symptoms of endometriosis? So the symptoms, the most common symptom is pain. So the pain is generally localized to the pelvis, but if there is endometriotic deposits outside of the pelvis, that can cause pain. The pain can be cyclical or non-cyclical. What is cyclical? So cyclical means it coincides with the menstrual cycle. Non-cyclical is pain that can be outside of the menstrual cycle, or it is irrespective of when the menstrual cycle occurs, the pain is always present. The woman may experience pain during micturition or defecation, as in passing urine or opening the bowels. There can also be painful sexual intercourse. So this is different ways of how pain may present. The other symptoms that can contribute as a part of endometriosis is general fatigue, tiredness, and the next major one is infertility. So if a couple is struggling to fall pregnant, then definitely endometriosis is something that needs to be excluded. What are the causes of endometriosis? So there's actually no cause to this, although a significant family history plays an important role. Next thing that we look at would be the diagnosis of endometriosis. So how do we diagnose? First of all, a good history from you is very, very important for us to suspect endometriosis. I'm sure many of you would have visited doctors with pelvic pain, and that pain has been either dismissed or trivialized by either family members or doctors themselves. It is a little bit unfortunate, but with ongoing awareness and education, I think endometriosis is being picked up relatively early in the course of the disease. So the other investigations that are needed to confirm the diagnosis are ultrasound. So the most simple and minimally invasive investigation that is available to us. How is the ultrasound performed? So the ultrasound is performed through the tummy. Although we can see most of the organs through the tummy, we get better quality images with an internal ultrasound through the vagina. But if someone is uncomfortable having an internal ultrasound, or if it is too painful, alternatively, MRI of the pelvis is available. Now, generally the gold standard for diagnosis has been laparoscopy. So what is laparoscopy? Laparoscopy is a small keyhole surgery where a small incision is given into the belly button and the camera is passed through that, and we take a direct look at the surface of what we call the peritoneum, which is the inner lining, and the covering of the pelvic organs. It may be difficult to visualize these endometriotic deposits because they can blend in with the surrounding normal surface of these organs. So they may be pink and it makes it difficult for us to diagnose. So that does not mean you don't have endometriosis, it just means it is difficult for us to diagnose you with that condition. So how do we manage or treat endometriosis? Generally, the treatment options are offered to you. You make the choice which would encourage compliance and adherence with the treatment options. So the treatment options are classified into 3 different options: non-medical or conservative option, medical and surgical options. So under non-medical option, definitely nutrition. So looking after your gut, because there is a link between unhealthy gut and endometriosis. So really important for you to eat clean, healthy, and definitely exercise is also part of pain management. So those 2 never goes out of fashion. Always stick to that, irrespective of whether you go on to either medical management or surgical management. This will help throughout your life, because this is a disease that's going to start right from the day of first period, that's menarche, till menopause. So it's a long journey. So if you want to manage it, it is important that you do the non-medical in conjunction if you have to go with the medical or surgical options. Under medical options, the treatment options that are available to us are to treat the pain per se and treat the estrogen responsive endometriotic deposits with hormonal management. In terms of pain management, they are as simple as starting with Panadol and scaling upwards depending on the response to the pain management. Now, for someone who does not want to use hormonal treatment, this could be one of the options, although the response and the reaction to that depends on how you are going to manage the pain as well. In terms of hormonal treatment, why do we choose hormonal treatment for endometriosis? The main reason is that these endometriotic deposits are estrogen responsive deposits. So if we were to quieten them, hormone treatments are necessary. What are the options in hormone treatments? It could be as simple as an oral contraceptive pill. It may not be used for contraception in this given setting, but it does help with quietening those estrogen responsive endometriotic deposits. Now, similarly, there are other options in the hormonal treatment like GnRH analogs, which basically induces like an artificial menopause. So these endometriotic deposits can be quieted. Unfortunately, all medical management will come with their own side effects. But in a given scenario, I would encourage you to analyze the risk-benefit ratio, and if the benefit outweighs the risk, I would encourage you to think about medical management. So the last option that is available to us is surgical management. So what happens in surgical management, or what is the meaning of surgical management? So generally, a laparoscopic approach is used for both diagnosis and therapy. So laparoscopy, as explained previously, is a keyhole surgery where a small incision is given under the belly button. The camera is passed through that and we take a look. Sometimes if there are significantly big endometriotic deposits, say for example, if both ovaries have got big endometriotic deposits, which are generally called as chocolate cyst, we may have to remove them, which is called like debulking. Or if there are multiple endometriotic deposits that we can see in the pelvis, we generally tend to burn them off to minimize the pain and reduce the long-term adhesions of the adjacent organs to these deposits. So surgery will help in that aspect. Of course, in a person who is planning for pregnancy, simultaneously, sometimes we will be able to check the patency of the tubes as well. So if you would like more information on endometriosis, please visit our website www.athenawomensclinic.com.au, and you can book an appointment with us to learn more about endometriosis and discuss your treatment options.